why COVID-19 will hit Marjorie harder. If you've wondered why many more Black and brown people get COVID-19 and die from it than other people in the United States, then Leandris Luberd might be able to tell you a story about somebody you already know. Leandris might call her Marjorie. Marjorie could be the cashier that you chat with, or your grandfather's favorite nursing aide in a long-term care center. Marjorie is Black, about 47, and despite following public health guidance the best she can, she will test positive for COVID-19. Marjorie is not an actual person, but she symbolizes people that Leandris advocates for as the Chief Health Equity Officer in the CDC's COVID-19 response. Groups of people at increased risk for the disease. They include Hispanic, Native American, Alaskan Native, and Black people. And although each community is unique, many people in these groups have suffered much more in this pandemic. They are more than 2.5 times as likely as white people in the United States to get COVID-19, and on average about 5 times as likely to be hospitalized, according to CDC's data. They are more likely to die from the disease, particularly Black patients who are twice as likely to die. To help the CDC develop recommendations that work better for people in highly burdened communities, Leandris researches their specific public health needs and informs colleagues about those needs. In the 3 months since she took on her newly created role, work for her team has piled high. My days start early and end late, and I work into the weekend because emails keep flooding in. Leandris makes that comment and says she herself is also Black. When she speaks in webinars, thousands of people attend, and then requests arrive for her to do even more. The workload would have worn on Leandris in the past, but now it energizes her because many more public health professionals are clamoring to hear what she has to say about the health inequities that people like Marjorie face. Leandris says, "It gives me life to be able to play such a central role in this response." Data guides all of her work, but compassion drives it. And Leandris, who is a medical anthropologist, believes in the power of storytelling. To help you understand why Marjorie will not be able to avoid getting COVID-19, Leandris might ask you to picture Marjorie ringing up 100 shoppers in a checkout lane before taking the bus home to her tight-knit family. They live in a small 3-bedroom house where the grandmother has her own room, 3 teen daughters share one, and the parents have one, Leandris says. Grandma has high blood pressure and diabetes, and sometimes needs a walker, and Marjorie's husband drives a truck. Their jobs put Marjorie and her husband in contact with many people, and some of whom don't wear masks. Their managers don't always mandate good practices to limit exposure to COVID-19. The family's rainy day fund is sparse, and their employers don't offer paid sick leave or health insurance. Grandma helps keep the household afloat by watching the girls and running the kitchen, and that family cohesion makes their life beautiful. Grandma doesn't face loneliness and can pass her knowledge down to the teenagers, along with stories about family history. Leandris comments, "We at CDC need to be very sensitive to how people live in their communities and find ways to help them be safe in their own environment." Marjorie gets a cough and tests positive for COVID-19. She'd isolate away from home to protect Grandma, but can't find guidance anywhere on how to do that or how to get food while she does. She'll lose at least 2 weeks of pay and maybe even her job. So Marjorie's husband stays on the road to keep money coming in, even though he's worried sick. And he also refuses to get a COVID-19 test for himself. Leandris comments that in my community, some people are hesitant to get tested because they're afraid a positive result will make them miss work. Missing a paycheck or two could easily make them go under financially. Grandma will care for the teens, but what if she falls? Many families, including white families, face predicaments like the one Marjorie's family does during COVID-19. But within these vulnerable groups, a disproportionate number of people end up in acute crisis, Leandris says. Leandris is at least indirectly affected by health disparities herself. Her sister is on dialysis and leads a small household with a daughter and 3 grandbabies. I worry about my sister every day, Leandris says. My niece works in a long-term care facility and comes home every evening. I'm as anxious as the next person to get to the end of this pandemic. Leandris is thankful that CDC research revealed the disproportionate suffering in COVID-19 by people who are historically and currently disadvantaged because of their race. In an unfortunate way, COVID-19 has given us a new opportunity to rigorously learn so much more about what drives health inequities, Leandris says.